Good day to everybody. I am grateful to organizers to invite me to speak on the topic of care of HIV-infected adolescents. I have no conflicts to disclose. Today, during this session, we will review the epidemiology of HIV infection among adolescents. We will then discuss barriers and facilitators within the cascade of care and treatment among these populations. And we will spend some time focusing on special considerations when caring for adolescents and youth living with HIV compared to younger children and adults. Adolescents constitute approximately 2 million people living with HIV globally, and this is about 5% of all people living with HIV. When you look at the circle, you can see the distribution of youth globally is quite shifted to African region. In fact, the majority of youth and adolescents living with HIV come from Eastern and Southern Africa, and followed very closely by West and Central Africa. And together, this region comprises 85% of all adolescents 10 to 19 years living with HIV globally. But when you look at overall expansion of youth population globally, you realize that in this region, so heavily affected by HIV epidemic, we are seeing also an exponential growth of youth population 15 to 24 years, compared even to large countries like China and India. And indeed, by 2030, the youth population in sub-Saharan Africa is expected to have doubled from the start of HIV epidemic in 1990s. And when you look who is leading the epidemic in this region, you realize that more than 500,000 of young people 15 to 24 years become infected with HIV approximately each year, but the majority in sub-Saharan Africa, most heavily affected by HIV epidemic, are actually young girls and young women. And in fact, if you look at the bar here with orange color in the middle, you can see that more than 50%, close to 80% in Eastern and South Africa of new infection in this age are represented by young females. And actually in Eastern Europe and Central Asia, this proportion is also over 60%. Specifically, youth 15 to 19 years represent about 42% of all these new cases, and they comprise together 16% of new adult infections.